thyroid emergencies are a critical challenge in medical practice, as they include life-threatening scenarios such as thyroid storm and myxedema coma. Thyroid storm, resulting from an exaggerated response to a sudden elevation of thyroid hormones, can cause hyperthermia, tachycardia, neurological alterations, and multi-organ failure. Myxedema coma, a consequence of an extreme deficiency of thyroid hormones, manifests with hypothermia, respiratory depression, and severe hemodynamic compromise. Both conditions constitute endocrino-metabolic emergencies that require immediate recognition, as without treatment they lead to high mortality. Specialization in this field involves mastering advanced diagnostic tools and applying specific clinical scales, such as the Burch and Wartofsky score, which allows assessment of the severity of thyroid storm. It also requires in-depth knowledge of emergency therapies, ranging from the use of beta blockers and antithyroid drugs to the administration of inorganic iodine, corticosteroids, and in selected cases, procedures such as plasmapheresis. In myxedema coma, intravenous hormone replacement and intensive support are therapeutic pillars, along with correction of metabolic disturbances and management of precipitating factors. Training in the management of thyroid emergencies reflects academic excellence and clinical leadership. Mastery of updated protocols and the ability for rapid intervention consolidate medical practice as a benchmark of innovation and prestige. Those who achieve this specialization acquire technical expertise to save lives in extreme situations and position themselves at the forefront of emergency, urgent, and disaster medicine, projecting a safe, rigorous, and high-impact model.